Now, if you are not in Arizona, you may not need to listen or watch this video, but if you are, you may want to consider learning about a small company that is female owned and led that may benefit your practice and possibly a long-term care patient that you may help manage. I'm at the Arizona Urological Association meeting, and I have Allison here who is with Target1 Medical. Now, it's not a big, huge budget, like one of these large companies, but I always want to make sure that you are brought to the forefront when it comes to interesting companies or interesting concepts. So, Allison, would you mind sharing with us what it is that your company does?
So we are a concierge lab service company. We specialize in infection testing, PCR testing, which produces results for a physician in 24 hours. And it gives very patient-centric, personalized results, which can help you manage and be able to prescribe quickly the right antibiotics, the right medications to help your patients. My goal as a company is to help keep people out of hospitals, whatever that means. Again, getting the right medications on as quickly as possible for that patient.
Now, we all deal with sometimes complicated patients with recurrent UTIs, and the normal urine culture doesn't grow anything. And I think that's when PCR urine culture testing is going to be effective. Some of us are doing PCR testing in the office, but as you know, in the members in this Thriving Urology Practice Facebook group, that vote to be productive with that testing to be done in the office, that boat has kind of sailed. The payment structure is much more difficult, but if you are interested in using PCR testing, then this is one of the companies that you can consider. But you are only in Arizona currently, correct?
So I'm currently in Arizona with mobile collection. So we have a mobile collection team in the Phoenix area, Maricopa County, and in Pima County in Tucson, which means for a continuity of care, a lot of the patients that you as a urologist might be seeing may have difficulty getting themselves a urine sample to your office to be tested. My mobile teams then can go out to wherever they are and collect the sample and get it to the lab. So I call it working as a team to help treat your patients.
So that is very interesting. So the patient can. I'm thinking about how this is going to work. The patient can call the office with symptoms of a recurrent of a urinary tract infection. It's an established patient. You already have a good history, and if the patient's having a difficult time, because and part of the reason why they have recurrent UTIs is probably they have some neurologic issue. They have a chronic indwelling catheter. They can't make it. It's not easy for my paraplegics to come into the office. It's a huge burden.
Exactly.
So now I can contact your company to
Yes.
go out and collect a urine sample on my behalf.
Yep.
I still
With
get the
an order.
results, and then I can still treat the patient. And for those of you who are astute coders and billers, telemedicine visits would come into play really, really well in this situation. That means you get the results from the PCR testing, you contact the patient, he or she stays in their home, and then you can code and bill and provide an excellent service for that particular patient. So that's interesting.
Yes,
Is that why you say that this is a concierge lab?
I do. I do because most labs leave the kits at your office and then they're kind of on their way. We try to be a team, right? I can send people, if you are within our collection area, I can send in people into your office to help package samples if needed. Just again, it's about getting your patients tests to a lab as quickly as possible.
Really,
Not
this is to
get
take care
lost.
of the patient and not and just eliminating the logistics headaches.
Yes, exactly. We have an app that we have built that allows me, once we have an order for collection, I can tell you from start to finish exactly where it is. Because a lot of times you'll send an order to a lab and then you're like, I don't know where the results are. I do. We know from start to finish.
Yeah, but that time period is going to be very, very quick because you usually collect the urine very quickly and then the results come back usually in
Next day.
24 hours.
Yep.
So it's good to know where the specimen is located, but I think not as important in this situation because PCR turnaround is so fast.
That is correct. Except that sometimes, even though I have an order to collect a urine, you may have an incontinent patient that it's difficult. So I may not be able to get it tomorrow. It may be 2 days because they have difficulty getting it. Another thing we have validated is we can take a urine sample from a wet brief for those incontinent patients. But it's about the process and making sure it's done correctly. It's not perfect from, everybody would love a clean catch,
Of course.
but we know that's not always possible. So
Yeah.
that is another option versus having to cath the patient to get a urine sample.
So I'm thinking maybe pediatric patients who can't volitionally give you a sample.
Absolutely, pediatrics as well.
Now, on the banner, it says innovative lab services for long-term care. Can you speak to that a little bit?
Um, well, first of all, I started this business in the long-term care space because there's such a need for patients that are in skilled nursing, memory care, those patients. That's how I started with mobile doctors. Those doctors already visit the communities, their primary care mostly. Um, that's why I started the business, because we offered this service for my people to go in, get the testing, and get it to the lab. That's how I started in long-term care. We've now branched into specialists like urology because we know there's a continuity of care between that primary care. Now they're recurrent infections, difficult to treat. That's why they're many times seeing the urologist now. So it's a nice way to marry the two situations.
Have you thought about, just came to me, have you thought about approaching maybe primary care doctors in getting your services done?
Absolutely. It's just a matter of how many places we can be in one day. Once people learn about this type of service and the type of testing even, they're like, why wouldn't we do it?
So
So it's
anytime I think about a technology or lab service, two issues for effective and widespread implementation. Number one is legal, which is not an issue. Secondly is financial. So does a medical office or urology office will simply send you demographic information and then you guys do all the billing and stuff like that, or how does that work?
our lab does the billing of that. We are in network with most major carriers, Medicare's, Medicaids. And we have our main lab that we have is in Houston, Texas right now, and we're building regional labs across the country. Phoenix is going to be the next lab. It should be ready this fall. Again, how can we make this easy and fast and efficient?
I love it. How do you make it easy and fast? And it's all about making it easy for the practice. As always, if I am being paid or if I have any financial interest in any company that I discuss, I will disclose that to you. I have no financial interest in Target1 Medical, and I will put their contact information in the video description and or comments. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other. And thank you, Allison.
Thank you. Appreciate your time.
All right.